As two large pharmaceutical companies get closer to rolling out a COVID vaccine, state and local health departments are creating plans for distributing it. But these efforts face many new challenges, including potential roadblocks in rural communities where there are fewer health facilities and fewer people. Our Washington correspondent Jesse Tenor reports in today's Excellus Blue Cross Blue Shield Health Report.
At least 2 coronavirus vaccines are within arm's reach, but polls show some Americans are still skeptical about taking them.
Reassure folks that it's safe and they should come get it.
Louisiana Senator Bill Cassidy hopes the rollout, starting with healthcare workers and nursing homes, makes everyone else more confident.
If your neighbor's a nurse in a rural hospital and you really have a high regard for her, I think it will make you feel more comfortable the fact that 2 months later she's doing great.
Cassidy, a doctor himself, is working to help states reach underserved populations and solve storage and distribution problems in rural areas.
It's challenging because of the cold chain requirement for some of the vaccines, but we know it's possible.
Different vaccines require separate distribution plans, but Dr. Monsef Slaoui, the chief advisor for the Trump administration's Operation Warp Speed, says agreements with CVS and Walgreens will help rural areas.
These vaccines will be available there.
There are also concerns about how the controversial transition of power from the Trump White House to a Biden administration could impact vaccine distribution.
More people may die if we don't coordinate.
President-elect Joe Biden continued to pressure the Trump administration this week to share its plan.
It puts us behind.
But Cassidy argues the vaccine companies have their own distribution strategies.
No matter who the president is, this is going to go forward.
With the first rollout possibly just weeks away. In Washington,